Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We're going to be speaking with Dr. Stuart Lustig, National Medical Executive for Behavioral Health at Evernorth. Evernorth is a Cigna Company. He's joining us to discuss key findings from the Evernorth Vitality Index, the largest study on the state of vitality, health, and productivity in America. This survey of more than 10,000 American adults aged 18 to 75 found that less than 1 in 5 U.S. adults report high levels of vitality. Welcome to Health Professional Radio, Dr. Stuart Lustig.
Thank you. Pleasure to be with you, Neil.
What is your area of expertise, if you don't mind us asking?
Sure. Well, I'm a child psychiatrist by training, but for the past several years, since I've been with Evernorth, we've been looking at a number of factors that relate to whole person health, vitality being one of those most recently, in addition to loneliness, resilience, anything that really impacts the body and mind integration that is really quite fundamental to our health.
But what's a good definition of vitality and why is it so important to our health?
Well, vitality is really that ability to pursue life with energy, with vigor, with as much health as possible. And one of the things that we have found in our study is that it connects with a whole host of factors that is related to overall well-being. And so, for example, we think of vitality as being the embodiment of self-determination, our ability to achieve what we want to achieve, to be competent at that, to make connections with other people in the way that we want to, and to really have a sense of autonomy. And that construct, vitality, which is so critical to our overall health, really transcends a number of different realms that we think of as being part of our well-being. Physical health, emotional health, spiritual health, financial health even, social health, connectedness with others, environmental health even. And so it's really an all-inclusive construct that we found correlates with a number of measures of overall health.
If any aspect of that all-inclusive construct is lacking, does that automatically equal some type of depression?
Well, not necessarily. In our study, I think just to take the big picture, first of all, one of the things that we found was that physical health did correlate with vitality. People who had high vitality scores on our Vitality Index, the Evernorth Vitality Index, those people were more likely to be physically healthy. They were more likely to have higher vitality. So that correlation was there, but it definitely wasn't the only thing. And we knew that because, in fact, as you get older, you actually tend to get more vital. And that doesn't jive with what we think about as young people being the healthiest, right? So there's obviously more to it. There is an emotional component. And to answer your question about depression, we did, in fact, find that people with lower vitality were more likely to suffer from depression, from chronic pain, from substance use issues, for example. So that's all part of it. But we also found some interesting things as well, that they were more likely to, people with higher vitality were more likely to be productive at work. They were more likely to enjoy their work, to get promotions, to stay on the job, to be less likely to want to leave their jobs. So it really is, as I mentioned, an all-inclusive construct. Physical health is a big part of it. So is emotional health. Sleep quality is part of it, and feeling connected with others.
More than 10,000 participated in the survey. What segment of that particular population was seen to have the lowest and highest levels of vitality?
I'd say age was a factor. And so if we look at the Gen Z population as a whole, vitality was lower in them. And in fact, we found that to be consistent with some of the previous work I mentioned that we had done with loneliness and resilience. So that population that we think of as just launching into the workforce, they've just become adults. We expect them, or they expect themselves, to have what it takes to go out in the world. But in fact, that's not always the case. And in fact, their vitality as a whole is lower. And so if you look at Gen Zers, 1 in 10 of them lost a job in the past year, and only a third of them are actually satisfied with their work. So I think the message to healthcare professionals, particularly those who may be working with students or young people entering the workforce in their realm, is to really to take those young folks under your wing really look out for them. Realize that they may not be as connected as everyone else is. They may be struggling with emotional issues potentially, particularly in these times as we emerge, hopefully, from this pandemic. And so really keep a lookout for the young folks.
Talking about emerging from this pandemic, is vitality going to be the next generation measure of health?
Well, I suspect it really will be because we do need something that just goes beyond a BMI measure or a blood pressure or a hemoglobin A1C, right, for those folks who are struggling with high blood sugars. And we need more than simply a pH 2.9, which is a measure of depression. So we need something that really captures the totality of people's experience, I think, of being human. And vitality, I think, comes close to that. And we worked very hard before doing this study and partnering with Richard Ryan, who is the world's foremost expert on vitality. We took a look at some of the things that were out there in the vitality space, realized that we, in some ways, were gapped, I think, in terms of our ability to measure not just individuals, but also communities, business environments. And that's where we really stepped in and came up with the Evernorth Vitality Index to capture something that was as inclusive as it could be.
Well, what can people who would like to learn more about vitality do to get that information?
A number of things. A good place to start is our website. And if folks go to newsroom.cigna.com/vitality, so newsroom, all one word, .cigna, CIGNA.com/vitality. There's a lot of information there. Folks can read up on the results of our study, take a look at the quiz that we have there, and also get some just personal hacks for ways to boost one's own vitality.
Is there anything that you'd like to add for us?
Yeah, I would just add a few things that I think that are pertinent really to other health professionals. We are so busy as a profession, as an entity, really taking care of other people. And I'd say it's critically important. I know folks know this, but they don't always do it, to really take care of yourself, take care of your own vitality. So just some of the basics, making sure you build in a little bit of exercise, connecting with other people. We found connection to be important in our study for boosting vitality. Eating a healthy diet, not too many processed foods, lots of fiber, whole foods wherever possible. And we found, in fact, that folks who eat more fruit tend to have high vitality. Obviously, this is a correlational study. As the audience will know, it doesn't prove causation, but I think it does suggest that paying attention to what you put into your body is going to help your body be optimally healthful. And I think the good news for health professionals is we are doing a good job of taking care of other people, because folks who come to see us, those who have an annual checkup, also report higher vitality. So there's some nice correlations there. And so all of us should make sure that we're getting in for our regular checkups as well, and be sure we have the resources that we need, whatever those may be, as we go through our lives and try to maintain our own vitality.
Stuart, thank you so much for joining us here on Health Professional Radio. Hopefully you'll come back and talk with us again.
I would love to. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Stuart Lustig. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.